Why do doctors use electrocautery for colon polyp removal? Imagine a tiny growth inside your colon that could turn into a bigger problem if left untreated. That's what a colon polyp is. Most are harmless, but some can develop into colorectal cancer over time. During a colonoscopy, doctors look for these polyps and often remove them right then and there. One of the main tools they use for this is electrocautery. Electrocautery involves using a special device that delivers a controlled electrical current. This current heats up a tiny wire or probe, which the doctor uses to cut through the polyp tissue. The heat from the electrical current doesn't just cut, it also helps seal off blood vessels at the removal site. This sealing action is crucial because it reduces bleeding, which is the most common complication after polyp removal. The reason electrocautery is so popular is because it allows for precise removal of the polyp. For small polyps, the risk of bleeding or damage to the colon wall is very low, so electrocautery makes the process quick and safe. For larger polyps or those in tricky spots, the ability to control bleeding becomes even more important. Sometimes, doctors may add tiny clips to further secure blood vessels and prevent bleeding. Using electrocautery during a colonoscopy is generally very safe. Serious issues like perforation or infection are rare. There is a small chance of something called post-polypectomy coagulation syndrome, where the heat affects deeper layers of the colon wall, causing temporary pain or inflammation. But this usually gets better on its own with simple treatment. Removing polyps is a key step in preventing colorectal cancer. Electrocautery helps make this process minimally invasive and effective. It allows doctors to remove polyps during a routine colonoscopy, which is less invasive than surgery and involves a shorter recovery time. This approach not only lowers the risk of cancer but also reduces the chances of complications that come with more invasive procedures. It's important to remember that every patient is different. The size, location, and number of polyps, along with a person's overall health, influence how the procedure is done. That's why talking with a healthcare professional is essential. They can recommend the best approach based on current medical guidelines and your individual situation. In summary, doctors use electrocautery during colon polyp removal because it allows for precise cutting, effective bleeding control, and safer, quicker recovery. This technique plays a vital role in maintaining colon health and preventing cancer through minimally invasive, effective treatment. Always consult your healthcare provider for personalized advice and to understand the best options for your health.